Hello, everyone. Let's take a closer look at winning OET Medicine Speaking Test step by step. Step 1. Start your 3-minute preparation. Review your scenario card to determine what is your location. Is the setting your office, clinic, surgery, hospital, etc.? Is this your first time meeting the patient, or is this a returning patient? Why is the patient here? Lab results. X-ray or similar procedure results, or sports injury, or what is the patient's chief complaint? Are you speaking directly to the patient or the patient's parent or child? Are they calm, angry, or panicked? Step 2. Your opening statement, greeting. Hello, good morning, or good afternoon. Introduction. My name is Doctor, your name. Add your title and role if helpful for the scenario. Example, I am your surgeon. Or, I am the ER doctor on duty today. If this is a returning patient or you are making rounds in the hospital, use patient's name. It's good to see you again. As a reminder, my name is Doctor, your name. Step 3. Gather details. May I confirm your name? Or how should I address you? While this step is optional, using the patient's name is a commonly accepted practice and will increase your score when you use their name in your conversation. Find out why the patient came to see you. Patient name. What brings you here today? Or, you are here for your test results, correct? Hint: do not ask a patient who is admitted to the hospital why they are here. You should already know why. Instead, ask, patient name, how are you feeling today, to start the conversation. Step 4. Empathy or sympathy. You should use empathy and sympathy often throughout the role play, but using it here will ensure that you do not forget. Examples. That sounds very painful. Or, I am very sorry to hear that. Or, that sounds very stressful. Or, that must be very frightening. Or, I understand your concern. Choose the best option for your scenario. Hint: if a patient tells you they are concerned about cancer, heart attack, etc., because their relative died from that disease, your first response should always be, I am sorry for your loss, but let's discuss your... Step 5. Individual tasks. Tasks vary greatly by scenario, but there are patterns and similarities. For example, sports injuries, requests for sleeping pills, need to change diet or stop smoking, etc. The beginning of each task is a clue to what you need to say. For example, explore. Tell me more about. Explain. Teach them about their disease or condition. Reassure. I can assure you that. The patient will always push back at least once. What's the worst that can happen if I don't? Get surgery or lose weight or take this pill or stop smoking. Be prepared to overcome their objections. When discussing the patient's diagnosis, use the statement, based on your history and my examination, I believe that you have, or your symptoms, or results, are consistent with this disease. Let's discuss some further tests. Note: when asking questions, ask each part of your question separately. Where is your pain? Stop. Describe your pain. Stop. What makes your pain worse? Stop. On a scale from 0 to 10, what is your pain level? OET does not like compound questions. Step 6. Review and close. If you have time available, always summarize and review. Let's take a moment to review what we discussed. Then, is that correct? Once you have completed the tasks, if you don't have any more questions, I will write your prescription, or refer you to a specialist, or follow up in 2 weeks, or offer a brochure covering the main topic of your discussion. Then, stop. You have finished the role play successfully. It is important to remember that OET is an English test, not a medical test. Focus on a friendly, easily understood conversation. Good luck. Learn more at YouTube at MedGenius Study and coffee.com MedGenius.